hello, and welcome back to the channel. This is your public health safe space where we discuss topics that affect and impact the community. Well, today it's another chilly day, but we're here. We're going to have a discussion. Today we'll be addressing something that we would simply define as balance. And we're going to talk about public health and this balance. So stay tuned. Get ready. We're going to have another discussion. I hope you enjoyed the previous series about autism. If you haven't watched it yet, go ahead and click on those 4 video series and enjoy. Now today we're starting another one, and it's not about autism, but what did I say? It's about balance. So let's get on this journey towards balance, health balance. Thank you. Another beautiful day, isn't it? Yes, we enjoy winter. So let's get the discussion started as we take our little stroll. And this little stroll will help us have a conversation and clear up a few things that I've had some comments where it seems that this conversation is necessary. Now, as we know, in the United States, we spend more per person on healthcare than any other country in the world. Nearly twice as much as many other high-income nations. And yet, life expectancy in some American communities is more than 10 years shorter than others just miles away. Isn't that amazing? In America, your health should not depend on your zip code, but based on conversations, we know otherwise. It should not depend on your income, your employer, or whether your local hospital is still open. And that, the hospital situation, is a discussion for another day. Yet for millions of Americans, it does. Health inequity is not a slogan. It is measurable, and it affects families in every state, rural, suburban, and urban. Today, we're taking a fair, fact-based look at the policy fixes that can ignore, not just ignore, but we can't ignore these fixes. Many have ignored them, but today we're going to take a look at these because we cannot ignore them. They cannot be divided, but we have to strengthen outcomes for all Americans. Now, our topic today is struggling with health inequity in America, the policy fixes that we can't ignore. Health inequity refers to preventable and unjust differences in health outcomes. For example, Black women in the United States are approximately 2 to 3 times more likely to die from pregnancy-related causes than white women. Rural Americans face higher rates of heart disease and hospitalization closures. Chronic diseases like diabetes and hypertension are more concentrated in low-income communities. Now, these are just some of the examples. I'm sure you could add 2 or 3, even 4 more to it. But we're going to delve into these situations so you understand how inequity affects public health and how it affects preventative health and just planning for basic health care. These patterns that we're seeing are not random. They reflect differences in access, stability, prevention, and policy design. Now, we think and we wonder and we say to ourselves, so how does policy shape health outcomes? Well, there are 4 aspects that we're going to speak about today. Coverage gaps, public health infrastructure, social determinants will be a part of the conversation as well. Now, let's take a look at coverage gaps. The Affordable Care Act helped to reduce the uninsured rate significantly over the past decade. That is non-debatable. However, millions remain uninsured and coverage stability varies by state. When coverage is inconsistent, preventative care declines and long-term costs rise. This isn't about politics. It's about continuity and access. So we're not going to use this space or this time to have a political debate. Now, when we speak of public health infrastructure, see, it's a regular day. And when we speak of public health infrastructure, the CDC provides national leadership, but local departments implement programs. Many operate with limited sustained funding, and that creates an issue. The United States spends far more on medical treatment than on prevention, even though prevention improves long-term outcomes and reduces emergency costs. So the conclusion can be made that when public health funding fluctuates, communities feel it. They bear the consequences. With social determinants of health, the research shows that medical care accounts for only part of overall health outcomes. That is housing quality, food access, transportation, education, and environments where safety plays a measurable role. A child exposed to unstable housing or food insecurity faces high long-term health risks regardless of their insurance status. And this is something that many parents can agree on and are facing now. Health policies must recognize this reality. Then there are workforce shortages. Over 150 rural hospitals have closed in the past decade. Yes, over 150. Many counties lack obstetric care. When preventative and primary care are unavailable, emergency rooms becomes the default. So instead of going to the clinic, the emergency room is playing the role of clinic, which is costly and less effective. Strategic workforce incentives can help close these gaps. Now, I want to present something to you. If we believe every American deserves a fair opportunity to be healthy, what policy change do you believe would make the greatest impact? Share your thoughts below in the comment section, but do so respectfully. Now we're going to carry the conversation in another direction as a part of the topic where we say policy fixes that we can't ignore. And this is very important because, of course, we could identify a problem, but identifying a problem without providing certain solution options would be pointless. And what we're having here are meaningful conversations. So let's delve into the policy fixes that we can't ignore. These recommendations are supported across multiple research institutions and policy organizations. We talk about stabilizing health coverage. Gaps in coverage increase preventable hospitalization and financial hardships, whether through Medicaid reforms, employer-based improvements, or marketplace stabilization. Continuity matters. Then we move on to providing long-term public health funding. This is very, very important. Stable funding will also go a long way into strengthening the organization and what we have now. And it's very important that we discuss and we understand how funding impacts what we are trying to achieve. It will impact local health departments, disease surveillance, maternal and child health programs, as well as chronic disease prevention. Every dollar spent on preventative care reduces downstream medical costs, and this is realistic and doesn't need much explanation. When we integrate health into a broader policy, then we also have to think of housing stability, which will reduce stress and asthma triggers for those with diseases. Food access lowers long-term diabetes risk. So we are linking what a change will do to certain disease processes. And so we talked about the asthma trigger, food access with diabetes, healthier choices in foods, reducing diabetes risk, transportation access, improving appointment adherence, because if we could get to a taxi, if we could get to a public health bus system, then we could keep our appointments and be early for them. Preventative care in this respect will become a priority. Health outcomes follow policy alignment. Where people are able to access what they need, then there's an adherence to policy and to care and health outcomes. Now we could say expanding workforce incentives, which is also important. We'll have loan repayment programs, rural practice incentives, community-based training pipelines, communities with accessible primary care experience better preventative outcomes and lower emergency costs. So for communities where accessibility is key, then of course we expect to see better preventative outcomes. Now we're going to look at enforcing mental health parity. When we talk about parity, we mean equal treatment in insurance coverage. And this is, of course, a fundamental. This needs to be a policy that is a right for everyone. The Mental Health Parity and Addiction Equity Act requires that mental health and substance use and their services be covered comparably to physical health services. And we could understand and say, yes, we need that. Physical health and mental health should be equally treated and respected. Parity includes similar co-payments, similar visit limits, because people who suffer from mental health conditions, they need more than just initial care. They need continuity of care. They also similar prior authorization requirements and comparable reimbursement levels. This is very important. Mental health conditions affect nearly 1 in 5 adults in the United States each year. So every community can say that they are impacted by this. There's no community that can deny this being an issue or a concern. Equal coverage supports earlier treatment, stronger families, and healthier communities. Now, we want them to also strengthen data transparency. You cannot reduce disparities. You do not measure. So we have to measure the disparity in order to reduce it. And this is where data comes into play. Better data by race, income, and geography helps allocate resources more effectively and efficiently. Both go together. Now, as we continue, we always try to debunk myths and we ask questions. So there are some myths that we need to retire. And let's begin with myth 1. America has the best healthcare system in the world. The truth is, the U.S. leads in innovation and specialized care, but access and outcomes vary significantly. Myth 2. Disparities are only about personal responsibility. The truth there is, personal responsibility matters, but opportunity and access shape outcomes. Myth 3. Rural and urban health challenges are separate problems. The truth is, both often reflect infrastructure gaps and funding instability. Myth 4. Addressing inequity is partisan, and that myth is something we've heard so many times. The truth with that is, stronger health outcomes benefit families, businesses, and communities across the political spectrum. Now let's look at our question and answer. I've had 3 questions that I wanted to discuss because they kept coming into the picture. The first one is it affordable? Preventable disease and unmanaged chronic illness already cost billions annually. Prevention and stability often reduce long-term spending. Is there only one single solution? Of course not. The answer to that is no. Coverage, prevention, workforce support, and cross-sector coordination must work together. Our final question is, why focus on disadvantaged communities? This is a question that many people ask, and it's not to sound unsympathetic or is not to be mean, but it's a fair enough question. Maybe it's not said properly, but we're going to tackle this question as well. Why focus on disadvantaged communities? Because improving outcomes in vulnerable areas strengthens the entire health system. Health is inequity, and health inequity is measurable. It is preventable, and it is addressable through thoughtful, evidence-based policy. This is not about ideology. It is, however, about outcomes. When more Americans have access to stable care, preventative services, and mental health support, families are stronger, communities are more resilient. We've had this conversation multiple times in many different ways, and we want to strengthen families. We want them to become more resilient, and the nation will benefit. The policy tools exist. The research is clear. The path forward requires collaboration and commitment to the well-being of the American public. I want you to advocate, not just for yourself, but for your family members, for your community, because the goal is a path forward. The goal is collaboration and commitment, and this is what we're about. Thank you so much for joining me today. Enjoy the views. It's a cold day, it's overcast, but we have much to discuss, and we started on another journey. Leave your comments in the comment section. Remember to share, like, and subscribe. And until we speak again, deep breaths, stay focused. I'm here to advocate for you and empower you, and we'll take this journey together. Thank you for joining.